Greetings. I'm Patrick Howard. I'm the CEO of the Housing Authority of Travis County. And at the Housing Authority of Travis County, we really believe that there's an important connection between housing stability and mental health outcomes. Stable housing not only fosters mental well being, it also is an important social indicator of health. So, with that, in recognition of BIPOC Mental Awareness Month, the Housing Authority wants to put on this session for you all today, this segment, to talk about this important topic. I have with me two esteemed guests that I would like to introduce now. Dr. Amanda Banks is the Chief Public Health Officer with Integral Care. Integral Care is the Travis County's mental health, intellectual and developmental disability authority. And this is really important for me because I have a child who is on the spectrum. So I appreciate the work that you all do. And we also have Vanessa Flores Newton. She's with Colors of Austin Counseling. And I met Vanessa last year when my organization actually did some training with Vanessa's team regarding emotional intelligence. Vanessa's organization focuses primarily on trauma-informed care and identity-affirming work. And so we appreciate the work that you do, Vanessa, as well. Thank you all for being here. To help frame today's discussion, let's talk about the data, the landscape of mental health, particularly for Black and Indigenous people of color in Travis County. Dr. Banks, what does that look like here in Travis County?
So I think the data tells us two stories. The first story is encouraging, and that is that Black, Indigenous, and people of color that more people are seeking help. And more people are having conversations in communities of color around mental health. The other story is that health disparities remain. And so when we look at Black, Indigenous, and people of color, the disproportionate outcomes that are represented when it comes to mental health and health inequities, that really reminds us that mental health does not exist in isolation. And it also reminds us that we have to be mindful of the conditions in which people live. And when we talk about where people live, where they worship, where they learn, work, and play, that all of those things impact health. And as encouraging as it is that people are seeking help, the data really challenges us to really look and examine the underlying conditions and reasons why people are needing to seek help, and even more for those who don't, why they do not.
Speaking of that, so there's help out there for folks, as you suggested. So what causes people not to seek the help? What is the stigma associated with mental health that causes folks not to want to seek help? Or how can we eliminate some of those barriers, if there are barriers that are preventing folks from doing such?
Yeah, I mean, I think I can say that the barriers are stacked, right? It's not just systemic, it's financial, there's a trust issue. I think when I first started this practice, what the data that I could see in my little bubble and silo was that the people that were coming to me for therapy were people of color. And they were yearning for someone who was representative of the identities that they held. And I think for a lot of people, representation in the person that they're seeking help from helps. It gets you in the door, but it's not what keeps you there, right? And access is a huge issue. Financially, can I afford this? Can I even afford health insurance to be able to use it to get the mental health help that I need? There's a piece around systemically. How many therapists of color or therapists who have that cultural awareness to be able to provide that type of care? How many organizations and therapists are there out there of that? There's way more now than there was before. But for a lot of us, the historical piece, the stigma around what it means to ask for help in general, the barriers around just asking and just admitting to yourself that I'm not well, I need help. And I've tried to get help before and that hasn't gone well. And how can I believe and trust that this time it'll be any different? And there are a lot of barriers. And to try to be the person on the other side saying, no, we are here to help. You can trust us. We do have the resources and the knowledge. I think that is hard to overcome, but if it's even harder just to knock on the door and just to find that.
I need help. And that's such a hard thing to say for some of
Yeah.
us. What do you think, Dr. Banks?
I think it's just what Vanessa said. And to add to that, I'll say it's not enough just to make services available.
Right.
And we, as organizations and entities, have to be able to ensure that those systems are worthy, that the systems that we work in, that they're worthy of the trust of those people who have had historical experiences of being misunderstood and being overlooked. And so we have to ensure that the services that we're delivering, that it reflects those individuals' lived experiences. So in other words, trust isn't really built around what we say,
Mm.
but it's how we create those services that connect to the experiences that people live day to day.
Yep.
So how's that not understanding sort of the construct? And so how do you go about doing that? Because we talked about systems. How do you create these systems and how do we make them fair, equitable, whereby folks be willing to engage in these kinds of services? How do you do that?
So I think there are multiple aspects when you look at that question. As I said, when we talk about it from a public health lens, it's looking at those conditions, right? And so it's really important that we do understand how those conditions impact a person's health and not look at them in isolation. So I think one thing that is important is building authentic relationships and building those relationships before the crisis happens. When we talk about building trust, one of the ways to do that is listen, not only listening from what I like to say ground zero, but listening before we even implement the programs that we deem to be effective for those that we're serving. I also think that collaboration is so very important and an acknowledgement of history. Because again, if we're not willing to address the underlying causes that bring people to services, then we're doing not only those that we serve and that we want better outcomes for, but we're also doing the very system that we're working for a disservice.
Yeah, I mean, I also think about our teams and the people providing these services, right? Most of the people that work at my practice, I would say 85% of my staff identify as BIPOC individuals or hold a marginalized identity.
Awesome.
And they work there because they believe in the mission and the people that we serve and the work that we do. And so when you think about, we're talking about underserved communities and the barriers that exist, the people delivering those services also experience that. And so, how do you create a team and foster a culture where your people are well and also doing their work to be able to serve others? And so I think that has to be a huge part of organizational culture where you are building a culture where you have this belief and this expectation that your team is also doing their own work.
Yes.
And as therapists, we have to do that. That's part of our ethics to be able to show up. And with our clients, how do you foster trust? You provide consistency. When you are a consistent person who can be there for somebody, that helps build trust. It's not just a one size fits all. And I think that safety is the prerequisite for depth. It is the way that we are able to go deeper with our clients and our community is by building safety. And you can't help and go deeper if that relationship is not starting to foster, which is why we are out in the community a lot. It's not just working in silo in our offices. We're tabling at events. We're speaking in organizations. We're taking people out to coffee to say, hey, we're here. We're not just hiding behind a desk all day. We want to be a part of this community. We want to be a part of something bigger.
That's powerful. It sounds like there's no quick fix and that there's a certain degree of investment that needs to be made in order to really address the issues. So I can appreciate spending the time and making the investments as you suggested. I want to switch to talk a little bit about housing and mental health. I'm a houser, and so we're very interested in understanding about how housing instability affects one's mental health. What are y'all's thoughts about what that looks like in terms of how housing instability may affect one's mental condition?
Yeah, there's so much there, right? When I think about Maslow's hierarchy, our basic needs have to be met in order for us to, one, feel safe, but in order for us to function. So if we're constantly living in this fight, flight, or freeze, constantly wondering where our next meal, where we're going to sleep at night is coming from, that trauma lives in our body. And for a lot of us, that is generations long. That is not new. So I grew up very poor. My mom was a single mom. My grandparents were migrant workers. They often didn't have food on the table. And I carry that with me. We call it epigenetics, this idea that the trauma that came before you also you inherit. It lives in your body. And so for a lot of people of color, a lot of the BIPOC community, the trauma is inherited. And we can't break cycles if we don't have our basic needs met. And housing is a huge part of that. And that constant instability keeps you stuck in that fight, flight, or freeze mode. That's the thing that keeps you from asking for help, that keeps you from getting a job, that keeps you from building relationships because you're on the defense all the time. And what I know with clients that I've worked with who live in that constant state, the exhaustion, the fatigue, the depression that hits, the grief, the rage, they're constantly living in that. And so I think housing not only gives us safety, but we have to have our basic needs met. And so where does that happen? And how do we work on that challenge first?
Absolutely. I think stable housing, it really is the foundation that makes everything possible. And so, to Vanessa's point, how can someone focus on healing if they don't know where they're going to sleep tonight? How can they focus on healing if they don't know if next month they're going to have stable housing? And so, housing is really the most powerful intervention tool that we have.
Yeah, I learned this term called psychological safety, and this sort of reminds me of how that was defined, giving folks the space, helping them to feel that level of comfort and safety, understanding that they can move toward self-actualization, if we're talking
Mhm.
about Maslow, when you have the shelter. So I appreciate you all's thoughts about that. We talked a little bit earlier about trust and cultural relevance. So maybe we could talk a little bit about that and why it's so important as you talk about engaging populations that need assistance, why that's such a integral part of that level of engagement and the ability to engage in a more impactful way.
People don't often think about this as a basic human need, but relationships, physical touch is also a basic need. We have to have some sense of connection and physical touch with others, whether it's a warm handshake or a hug, an embrace. Connection is such a big part of that. And so we can't heal without others. We heal in relationships. That is how we heal. And in order to there's a part of learning to trust again because you've not been able to trust before. And one of the ways that we do that is by engaging in new relationships and seeing if we can learn to trust someone new and learn to see how they will either be there or not be there. And we do that over and over again with people in our lives. And so I think part of the mental health piece that we're talking about, whether it's a therapist or someone, a caseworker, case manager, or teacher, I think that consistency and being able to take a risk and be vulnerable about what you're experiencing to give someone the opportunity to meet you where you're at, which is a really scary thing for a lot of us. But I think that vulnerability has to be a part of the healing too, and the consistency, I would say.
Yeah, trust is a big word. I think it can be such an impediment to seeing your real potential. And if mental health intervention is important, then the trust must be there for them to receive that assistance. So I can appreciate just the steps that organizations like you all take to really make sure that the cultural connections being made and that the trust level is being cultivated over time. So I can really appreciate all of what you're sharing. So if someone's out there today in the audience listening to the and wondering, how can I get help? Where do I start? What should I do? They have feelings about such. Maybe there's some apprehension. What do you all recommend as first steps?
I want people to know that they don't have to wait until a crisis comes to ask for help.
Yeah.
They can call Integral Care at 512-472-HELP. That's 512-472-4357. And they can receive the services, whether it's around housing, crisis support. We provide help for substance use disorders and just a realm of resources. And also, if someone is in a mental health crisis, they can also call or text 988.
Hmm.
And so, what I want to leave people with is that no one has to navigate a challenge alone. Help
Okay.
is out there.
Thank you. The last question. What gives you all hope for the future in terms of mental health? You talked about some of the data. It looks like folks are more willing than in the past to seek out assistance, but obviously there's still a lot of needs that are out there. And so for you all, what do you believe the future holds and what do you all look forward to in terms of seeing the state of mental health getting better, particularly for BIPOC populations, as we're talking about BIPOC
Yeah.
populations today?
Yeah, I think I'm seeing this more and more. I've been in private practice since 2015, and the landscape in which the mental health landscape here in Austin specifically, because that's where we live, has changed so much. And what we're seeing is more people are asking for help now than they ever have before. And I think that's just new generations. The conversation is changing. There's more representation in the mental health field. There are more resources out there. There are more podcasts and books. And just the conversation is happening around mental health. People are more vocal about it. And that removes the stigma. That takes away this fear that if I ask for help, that means something's wrong with me, or I need to fix something about myself because I'm not enough. The shame that just lives there. I think when we can talk about this secret that a lot of us hold, or secrets, the shame starts to dissolve. And I think that's happening more, and that gives me a lot of hope. Our office stays very busy, and a lot of that is because they have a friend or a cousin or a coworker who has gone to therapy, and they've had great success. And so I think just seeing other people around us and around you get the help that they need and see the impact of that has been really powerful, but also a reminder for us all that for generations before us, healing happened over music and food and in the garden and on the migrant field for migrant workers. This is not new. It just looks differently sometimes. And so if therapy's not your lane, that's okay, but find what is and find somewhere where you can be seen as a whole human and be taken into account as a whole person versus a symptom. And for us, removing that stigma is not just about diagnosing you or trying to give you medication or trying to fix everything. It's about talking about your experience and getting to know you as a person. And that's where we start. And so that gives me a lot of hope. And just seeing the people who are willing to engage and have those conversations is really powerful.
Excellent.
Yes. That too gives me hope when you
Yeah.
talk about the conversations that are taking place in the community. The other part is you shared that it may not be therapy. And one of the things that I'm proud of at Integral Care is that we're the host of the Central Texas African American Family Support Conference.
Yeah.
For 26 now, headed towards 27 years, we've hosted this conference that is geared towards addressing mental health, substance use disorder, and intellectual and developmental disabilities, as well as well-being in the African American community. And what's amazing about this conference is that it creates space for the community to come together, be it faith leaders, community professionals, clinicians, to have this space to have those conversations in an authentic and meaningful way, and in a way that is geared towards the lived experience.
Mm-hmm.
And so that gives me hope
Yeah.
that we've been able to do that for 26 plus years. What also gives me hope, and so for a plug, February 25th and 26th, 2027 at Greater Mount Zion will be the 27th annual Central Texas African American Family Support
Excellent.
Conference. But the other thing that gives me hope is the resilience of Black, Indigenous, and people of color.
That's right.
I'm going to say that again, the resilience, because in these extraordinary challenges that we're facing, we still demonstrate and exhibit that resilience and that strength on a daily basis, not only for ourselves, but for our families and for our communities. And that is nothing but hope.
Yeah.
So
Excellent.
that's what inspires me.
Thank you.
Yeah, and partnerships, right? Like
Yes.
being in this room, sitting with you all and knowing that there are other organizations and people who can help too. We are constantly referring our clients out for services. And so we can't do this work without each other. And I think the warm handoffs, the learning about what does your organization do? What events do you have going on? And sharing that with our community and to be able to exchange that, because I'll go to dinner and I'll just meet somebody who knows of a resource or has an event coming up. And I'm like, wow, that's amazing. I had no idea. And so just conversation and acknowledging people and asking
Yes.
the question.
Yes.
Yeah.
You are so absolutely right, because regardless of the services that organizations may offer, we can't do this work by ourselves. And
Right.
so it is so incumbent and so necessary for us to go upstream together so that we can improve the outcomes for the very people that we want,
Right.
to give them an opportunity to be able to thrive.
Excellent. Partnerships. I love that word. I love resilience. I love talking about giving people space, having trust, cultivating environments that people feel comfortable in. Those are important. Thank you guys so much. Vanessa Flores Newton from Colors of Austin, Dr. Amanda Banks with Integral Care. Thank you all for joining me today. I really appreciate it. And thank our listening audience for participating today in this discussion. I'm Patrick Howard. That's all for now. Have a great day.